Hey guys, it's Dane here. I just wanted to make a video about the diagnostic laparoscopy and findings that I recently underwent. I had this surgery done at Mercy Health System and Hospital in Janesville, Wisconsin. The performing surgeon and OBGYN, Dr. Elena Wistrom, very, very, very good and high recognized doctor. You may be wondering why I underwent this procedure, and I've actually been through this and something similar a couple times before. I have had my gallbladder and appendix removed. I underwent this procedure looking for a possible finding of endometriosis, which is abnormal tissue growth outside the uterus. We weren't sure what was wrong. I've had heavy menstrual cycles for years, very uncomfortable with lots of pain and bloating, and just haven't really gotten any good answers. I've previously been on hormone therapy, and so I've been on Depo for about a year, which I didn't get any periods with, maybe very occasional spotting, and I didn't get my period back for about a year after stopping it, which was wonderful. So anyways, let's just kind of go back to a day in the surgery. Today, I am actually 6 days post-op. My procedure was on last Friday, the 25th of March, 2016. I just have to look at my information sheet to make sure I'm not forgetting anything here. So once I arrived at Mercy Health System, I was taken back to the day surgery suites and checked in by a hospital representative. Not too long thereafter, I was taken by a CNA working on the unit for a height and weight, and I had actually lost a couple pounds prior to the surgery, probably from anxiety and such. I'm sure some of you can relate to that. Then I had to give a urine sample to make sure I was not pregnant. And then I went back to the room and waited for the nurse to come in and take my health history and make sure all the consents and forms we needed for surgery were signed. Then while she was doing that, another nurse came in and placed my IV. It was a very uncomfortable situation as it was one of the largest gauge IVs. And so that made me kind of anxious. And she was just kind of a weird nurse too, so that didn't help the situation at all. My IV got placed fine. Then I just had a little bit of time to relax. I got there at 5:45 in the morning. My surgery was scheduled for 7:30 a.m. Central Time. I had time to wait for the doctor and anesthesiologist to come back and speak with me before the surgery, and they did. So the doctor and the anesthesiologist probably came in around 7:10, went through a lot of health history again with the anesthesiologist and such. Then he came back not too long thereafter and placed a scopolamine patch behind my left ear, which is an anti-nausea patch that I've had with previous surgeries, and it actually really, really helps. So I was really glad that he was able to do that. So then actually at exactly right around 7:30 a.m., they were very on time. I think it was the surgical tech or somebody that was going to be in the OR suite with me, came to get me and pushed me back there, and she pushed me back to the surgery unit, back by the operating room suites, and my boyfriend was able to come back with me until we came up to the final doors, and then I gave him a hug and kiss and said goodbye. I'm sure a lot of you probably do the same thing to our loved ones. Then thereafter, we were going around the hallway, right before I was getting put in the operating room, and my anesthesiologist came to give me some medicine for anxiety. I think he gave me fentanyl, which is a narcotic pain medicine, and Versed, which is an amnesia medicine, to help me just really relax and, start to get me to doze off before heading into the OR. Once I went into the OR, I don't really remember much. I remember taking 2 puffs of my inhaler, which was really difficult. It was kind of like, how do you expect me to do this? after you've given me these medicines. But anyways, I was able to do that, and then I don't really remember anything. The rest is kind of a blur. You know, I woke up in PACU and I was fine. So you may wonder what the surgery is. A diagnostic laparoscopy is pretty much what it sounds. They're going in with anywhere from like 2 to 4 incisions. Most commonly, they're like 5 millimeters or less, so they're very small. And it's an exploratory surgery, and they're looking to see what could be wrong. And so that's what they did. My findings were what we thought they were. We were looking for endometriosis. And I think I explained what that is, abnormal tissue growth outside of the uterus. And so she was able to ablate that using a hook cautery. So it's not removed, but it's reduced, and that should help stop the pain for now. The bad thing about endometriosis is it can grow back. And the only way to really suppress this is with hormone therapy or to get pregnant. Neither of which are great options for me, so I'm still kind of debating what to do. If one of you viewers out there has had this and has any feedback on different types of hormone therapy, or what you've done after finding out you've had endometriosis or something, let me know. I'd love to hear from you. So with that, you know, we're just kind of taking it day at a time and seeing what my options are. I know as far as hormone therapy that we've talked about, I've been on Depo in the past, so there was talk about putting me back on Depo. Then there's a new one that's called, I'm actually spacing on the name of it right now, but it's one very similar to Depo that is an injection, and it gives you a lot of postmenopausal symptoms, and so I really don't want to be on that one. The other thing we've discussed is Nexplanon, which I'm really curious about and I don't know too much about. So again, if anybody out there has had that and knows anything about it, please let me know. I'd love to hear anything you have to say about it, as this might be an option. I'm also curious about any weight gain with possible hormone therapy. If you've had any situations like this, I would love to hear from you. So again, from there, we move on to the PACU, which is the post-anesthesia care unit. I was in surgery for about an hour and a half, you know, obviously the beginning getting prepped, and I was in the PACU for an hour and a half as well. When I got in there, I still had an oxygen mask on, in which they were giving me oxygen, and then they were able to stop that, take that off, and then they had to put me back on oxygen, but they were able to do that through a nasal cannula. For the first like half an hour to hour, they're really, you know, what the PACU's job is to get your pain under control after a surgery. And so they were giving me fentanyl and Dilaudid about every 5 to 10 minutes. You know, also some anti-inflammatories and medicines of the like. So I did okay in PACU. The doctor stopped by, I briefly remember that, and just asking a couple of questions. She also removed a huge knot of scar tissue at my umbilicus, so the belly button area, and she was not able to remove that with scissors. It was so hard, she said. So she actually had to go in with knives to remove that. So after that, I make it back to the day surgery unit, and I was there until about, well, I was probably back there for 4 to 6 hours, honestly, because you have to be able to urinate a certain amount in output before they'll discharge you. And I was just having a very difficult time. So, I mean, I tried multiple times and just wouldn't get anything. And so my boyfriend and I would just go on small, short walks around and in the unit to try and help encourage that movement. So eventually and finally, I was able to go to the bathroom, and I was able to get discharged about 10 to 6 p.m. in the evening. So what they would do in there is the CNA would check my bladder, like with a machine that's very similar to an ultrasound, to check the milliliters. And at one point, I'd actually gotten to 750 milliliters, so it was ideal that I went to the bathroom. So upon arrival home, I just really relaxed, took some pain meds. My doctor had me on Percocet, and just really tried to take it easy. I had my boyfriend here to care for me, so that was really nice. I got situated in a recliner, and just kind of kicked back that way as it was the most comfortable. And I would also use a lot of ice on my belly and incisions because that tended to help with my pain a lot. So like I said, I'm 6 days post-op right now. Tomorrow's a week for me since my surgery. The first week she's really wanted me just to kind of rest and recover. And at times I've overdid myself, so don't do that if you have this procedure. You're given those instructions for a reason, and really try to follow them. Don't let your parents sway you in any other direction like mine try to do, because you're just possibly harming yourself. So take it easy, rest and relax. Second week, you can go back to your normal activities as tolerated, but again, don't overdo it. I can't emphasize and stress that enough. Walk as much as you please, but again, if your body's telling you stop, please stop. I can't drive for 2 weeks. I think a lot of that is with the pain meds and just recovering and letting your incisions really heal. Excuse me. So, I'm definitely anxious to be able to drive again, but that's okay. It's not like we forget. Back to the surgery thing. I know I forgot to say real quick. I only came out with 2 tiny incisions. One in the belly button, and one about 2 inches and up to the left in the upper left quadrant. And then they are actually able to go in through your vagina and uterus as well, and place instrumentation and be able to move organs and such around that way, which I think is great because I think it helps reduce, a possible incision. So, I'd love to hear from you guys and have more information. If you have any questions regarding a diagnostic laparoscopy, anything about the procedure, some of the meds you're given, anything about, pre-op, post-op, PACU, recovery, I'd love to hear from you. I'd love to answer the questions. Also, if you'd like to know anything about endometriosis, or if you have anything you could even share with me, that would be absolutely wonderful. I'm looking forward to hearing from all of you. Sorry, this video is kind of choppy. It's my first one here on YouTube. Please like, subscribe, comment, and I hope to hear from you guys soon. Thanks so much. Bye.